Good afternoon, everybody. Thank you for being here. I'm not a teacher normally, so bear with me. If you guys have questions, feel free to jump in and ask. I'll try to do my best to monitor the QA, but maybe Sven, if you see something pop up, let me know.
Yeah, I'll do that.
And so I'm here to talk about equity timescales. I did this last cohort with for the results counts through the Annie Casey Foundation. And this was kind of one of the more useful tools that I found personally. I think it helped me not just with equity, but just anything really, like any major project or any major direction that you want to go to. And so I like how universal it was, but obviously we want to try to apply this in a way that can increase equity within our county. And so I hope you guys like the movie Dumb and Dumber. If not, you may not get all the pictures here, but for whatever reason, it just kind of clicked with me, and that was it helps me remember it. So, Sven, do you want to move on to the next slide?
Mm-hmm.
So why equity timescales? It basically as we have the Dumb and Dumber crew here, but through my career, I've talked a lot with my colleagues and my peers and my supervisors about, like, I feel like we're all on a bus together and we're trying to go somewhere, but sometimes if we don't know exactly where we're going, we can't make decisions that are aligned or congruent with trying to get us to where we're trying to go. And sometimes making a roadmap of that will give us a hand. And so equity timescales kind of provide that opportunity to you to map out your goal in your trip in smaller, kind of achievable increments. And the reason you want to do those smaller, kind of more achievable increments is that kind of increases your likelihood of success and making more of a positive impact. I think it helps the morale of your team and yourself as well once you realize that you're actually kind of chipping away at this problem and you're starting to make progress versus just kind of setting a goal so far away that it's really hard to track that progress, and it's hard to hold yourself accountable. So Sven, I don't know if you want to go to the next slide there. So here's our roadmap. But like I said, the equity timescales can help you kind of identify first, like, where do you want to end up? And that's really the first question we have to ask ourselves is, when you're setting this goal, like, what does that goal look like? And then, as I talked about a little bit, identifying some achievable waypoints, kind of benchmarks along the way, which will lead to improved morale, sustainability of your project, and being able to measure the increments of progress and being able to see what you've done. And we'll get into this later, but part of what I like about this equity timescale is you actually kind of work backwards, and for whatever reason, it kind of just makes you look at things a little different than trying to look at it from that linear moving forward position. Looking at it moving backwards kind of just gives you a different perspective and kind of helped me, at least with my project, kind of move along. So if we can move on to the next question here. But like I said, it helps with your alignment. It kind of ensures that whoever's driving the bus or wherever you're going, they know where they're going. And if you're not there, or if you're taking a break or whatever the case is, people know where they're headed and they can make decisions that are aligned with the direction you're trying to go. And you're going to hit detours. I hit a detour in my project, but having the understanding of where I was trying to go would just help me just understand it as a detour and not just completely knocking us off the rails. And then also for continuity. I don't know who's in this group, but for us in the sheriff's office, we rotate assignments oftentimes between 3, 4, 5 years. And so regardless of what assignment you're in, whoever steps into it, if you have a good plan and you have a good time scale here, anybody can step into it and just take it over. So if we can move on here. So where's the equity in this all? Like I said, that we kind of hit on the time scale part of it, or the timeline. But really hitting on, each waypoint when you're talking about equity should work to kind of chip away at that at that. Each waypoint should kind of chip away at the disparities, especially for the most burdened if possible. So we're not going to get into the small tests of change or things like that necessarily, but it's kind of just taking a smaller portion and trying to take your project and minimizing it into a smaller kind of like test project basically, and seeing if it works with a smaller group. But each step is working to interrupt kind of embedded practices and policies. Being able to measure this change in a smaller increment is going to lead to kind of improved morale, and it's going to help support your work moving forward. Anybody who works on a team knows that, for me at least, the team morale and the team dynamics are incredibly important in the success or the failure of a project. And so the more we can keep the morale together and the team moving forward, the better likelihood we are going to have for success. And it's also going to, you're going to have to engage a lot of times other agencies, maybe with the county or outside of the county, and having that support from partner engagement and that sustained alignment is really going to help with the success of your project. If we can move on to the next one here. So really, this is kind of not a generic, but it kind of explains what an equity timescale looks like. So if you look at the right now, it's kind of really just taking a real assessment of where you're at, and then a highly targeted execution focused on efforts close to hand that can make a difference right now. And then you kind of move on to the 1-year project, to catalytic practices and programs tied to key system levers are underway. Population level trends are beginning to shift. So really, you're kind of getting your project off the ground. You're starting to move in the direction that you want to go. 2 to 3 years, you kind of have some momentum built. You have a widespread practice, policy, program transformation, whatever it is. There's some evidence of the early system change and cross-system alignment, basically, that shows that what you're doing is working, hopefully, and your population level results are shifted significantly. In that 3 to 5 years, you've already established that momentum, and you're actually starting to change the system and the system transformation to produce the equitable population level result. Your priorities, definitions, and standards of success and accountability are transformed. And then when you get to that 5 to 20 year mark, now you start talking about culture and change and the beliefs and behaviors that really have a major impact. Personally, I'm big on culture and really trying to make sure that the culture is something that's positive. And to me, culture is going to have the most impact on an agency or any group of people. And so if you have positive culture, you're 70 to 80% of your way through the battle, at least in my opinion. So if we can move on to the next. So now we're going to kind of start diving into my project. At the time that I started my project, I was assigned as the chief deputy to the jail, and I was overseeing all jail operations. I've since moved to our operations division, and I oversee all of our patrol and basically everything not jail. So investigations and everything like that. But the context of what kind of led me to my project is years of experience. And when I was on the patrol side, most of my career was on the patrol side, but we saw the same individuals over and over and over and over again, and not a lot of change. And when I got to the jail as a lieutenant and then as a chief, it would become almost incredible. It kind of became frustrating because, as you guys probably see, a lot of people out on the streets, people come in, they haven't been caring for themselves medically a lot of the times. They're not taking care of their mental health needs. So they're not seeking treatment. They're not taking their medication. A lot of people have substance abuse disorder. They're unhoused. And it's a lot of these same people and these same problems that we see. And they come in really unstable. We would take, weeks or months to get them stabilized. They would be functioning kind of what seemed like really well in the jail. And we'd be able to have good conversations with them about what they're going to do. And then they'd get released to the community. And weeks later, they come right back and they're completely unstabilized again. So that was kind of the context and some of the frustration I had and a lot of other people had as well. If we could move on to the next one here. Then kind of as I was in the midst of kind of seeing this frustration, we also started seeing this epidemic of fatal overdoses in our county. And attached here, this graph, you're going to see the stats, but these are fatal overdoses in the community. That includes in the unincorporated areas of the county and in the cities. This is not in the jail, thank goodness, but this is just out in the community. But you see that in 2019, we had 57, and then in 2020, 62. And then all of a sudden, really fentanyl started kind of hitting our community. Around that time, we jumped to 96, and then 99. And then 2023, it's kind of running rampant, and we're now at 133. So in 4 years, we had over doubled the number of overdose deaths in our community. And what was the change? It was fentanyl coming in a variety of forms. And so pills, powder, mixed into other narcotics. We were seeing methamphetamine users who didn't use opiates that were dying from fentanyl overdoses because fentanyl was getting into the drugs that they normally use. And so, Sven, if you can move on to the next here. So this was all kind of playing out in my head as I was trying to come up with my project. And we talked a lot about focused populations and kind of taking a smaller, my overall goal is obviously to help everybody that was coming through the jail, but I also realized I was just going to get frustrated and not make a lot of progress without having a smaller group. And so being able to focus on a smaller population with that fentanyl crisis made me decide to start working on the subpopulation, the substance abuse disorder population. That was based, like I said, on the increased fatal and non-fatal overdoses in the community. The overdoses in custody, luckily all of those were non-fatal, but we saw an uptick in overdoses in custody. We had a new fentanyl crisis response team on the enforcement side that was targeting the fentanyl dealers. But I think to attack any problem successfully, you need to hit it from different angles, and you can't just hit it from one side. So we were dealing with a lot of the user and the demand side of it. And for me, it made sense to work on the treatment side as well and try to reduce demand. And so that was kind of how I selected my target population. I kind of took an analysis of what I thought we were doing well. If we can move on to the next slide there. But some of the things I thought we were doing well, we had some good inmate programming, including job skills. We had the WRRP program for our female population through Blaine. We were doing a lot of that, getting people successful once they were stable. We were getting them into programming, which was really helping stabilize them and kind of, try to give them some hope. In 2020, we started providing medically assisted treatment services, which is kind of a medically supervised way of trying to detox individuals from illegal substances by providing the medication and other things that help curb the cravings for narcotics. Initially, we were kind of hampered and limited by some of the regulations. Within a year or two, we were able to kind of get past that. And as of now, about 20 to 25% of our population at any given time is receiving MAT services, primarily for opiate use disorders. So that kind of gives you an idea of the population of people at our jail. There's no wait list for anybody who comes in. If they come in as a drug user, we provide them MAT services. So if we can move on. Then I looked at some of the, what I thought were areas of improvement for us. And again, this is just gonna be my perspective. But to me, the most critical time was within the first 3 to 4 days of their release. And that was where people would kind of make that decision to either go down that same old path or were they going to try to change their life in a positive direction. What I saw was that there was a lack of treatment beds in the community, especially for substance abuse disorder and mental health, but there's a lack of real reentry planning with appropriate community providers. And we did a little bit within the sheriff's office, but really our jurisdiction ends once they get released and then they're out. And so trying to invite the community and community providers that were providing these services and helping plan for this kind of stuff, trying to invite them into the jail and getting them to start that process of working with them before they get released. rather than telling them, there's kind of this attitude, I think, that was, hey, just check in with us once you get released. Well, if someone gets released on a Friday afternoon, that agency may not be open until Monday or Tuesday, and they're unhoused, they're narcotics users, they may have mental health issues, and they're kind of just left with nothing during that weekend, and then they're just going to probably go right back to the lifestyle that they know. And so it didn't seem like it was working. My office window at the jail was basically right next to the lobby, and I'd watch people get released all the time. And I'd watch them walk up to the levee, and then I'd go take a walk on the levee at lunch or whenever. And unfortunately, I'd see a lot of the same people that I just watched get released, and they're over there using fentanyl or using other narcotics or hanging out with the crew that I know is going to probably get them into trouble. And then I'd see those people right back within a day or two. And so there's just some frustration there with that, and trying to understand, like, how can we try to improve that. If we can move to the next slide. So when I put BART in here, Sven, you may have to help me. I can't remember what it totally stands for, but the way I interpreted it is understanding like what my area of responsibility and what I can actually do within my role. And so,
yeah, just to jump in, the BART is the boundary of area, boundary of I'm gonna blank on it also. Boundary of authority, role, and task. And so it's really about how you take up your role within a certain task, and thinking about the ecosystem that you're working with in terms of all the staff that you have, the partners that you're working with, and making sure that as you all come together that you're clear on lines of authority, roles, and what the task of that team is going to be.
Way better than I could have said it. And so a lot of this involved us partnering. And so we contract our medical services that was providing MAT services in the jail. So I started working with our discharge planner and our substance abuse counselor that was working in the jail. The sheriff's office had also partnered with Janus, who opened and we worked with the county and Janus to open up the sobering center, which was located basically in front of the park, in front of the main jail. And so, I started talking with Amber Williams from Janus, and really we kind of all came up with this idea and kind of like a roadmap that we all kind of thought might actually help with this problem, in particular towards substance abuse users. And so we applied for a grant through the state first to help improve MAT services within the jail. With that, we were going to hire an analyst that would help kind of track stats and help manage the program, as well as help provide us some money and funding for some of the medication, because some of the medication is really expensive. And we ranked number 1 in the state. And then unfortunately the state had budget cuts. And so they basically told us, hey, you ranked number 1, you're probably going to get this. And then 2 weeks later, they emailed us back saying, hey, unfortunately, we think this program is probably going to get axed in the state budget. And unfortunately, it did. And so we lost that. So when I talked earlier about detours and alignment, it's really important to understand what that alignment is and where you're trying to go, because that if we didn't have that, that could have just completely derailed our project. And building that partnership with NAFCare, which was our medical provider at the jail, and with Janus, Amber was able to find other funding that she had a grant for, and it was like, hey, let's keep moving forward on this. And so we did. So our roadmap was basically, let's provide MAT services to everybody coming in that qualifies. And then if possible, we offer these long-acting injectables, which is a shot basically of this medication that lasts about 30 days, and it helps reduce their cravings. And so the idea was, if we could give them that shot within about, hopefully soon, contemporaneous to when they were going to get released from jail, we could get them out in the community. There'd be less chance of them overdosing within those first 20 to 30 days. And hopefully it would give them, about 30-day window to to be able to try to establish and stabilize themselves out in the community, get a job, housing, whatever it was, without having those cravings, or at least as strong of cravings. And when I talked about the money part, these long-acting injectables are around $1,500 per shot, and so they are not cheap, and that's where we were trying to get money from the grant. And so also part of that was having a warm handoff to a Janus case manager. As I said, I thought that it seemed like that weak link was often the first, few days of somebody getting released. Having that warm handoff to Janus for people that are on MAT services, when they get released, we just call over to Janus or we shoot them an email, and then they say, okay, we'll be over there at 10 a.m. or 11 a.m. And then we could coordinate that release and release that individual right into the care of Janus, who has a case manager there. They are able to actually take some of those people to long-term treatment right off the get-go. Others, they were able to get enrolled in MAT services and at least provide those kinds of services. So there was that warm handoff and hopefully increased success. So we increased some of our MAT counseling in custody, and then also with some data collection. And then just Ben, if you can go to the next. So our end goal was all of our partners would view the jail as an opportunity, kind of not as a timeout, which I think stems back to that original frustration I had, that everybody kind of looked at jail as just a timeout, and then, hey, when you get out, come check in with us. But that doesn't work for a lot of these people, especially the at-risk populations. And so I wanted people to see it as an opportunity. People are stable, they're housed, you know where to find them, they're eating, they're taking their medication, they're medically stable, and here's the best opportunity you have to try to reach out to these people and have a positive impact or a positive intervention in a lifestyle that's kind of led them to jail and a lot of other things. Obviously, we wanted to reduce overdoses, both fatal and non-fatal, both in custody and out in the community. We wanted to reduce arrests, recidivism, which really creates a safer community, and then improve quality of life for everybody. So anyways, so this is a blank template for us to work on later, or to look at later, of how to move forward. And then if you want to move on to the next one real quick, Sven.
I think this is yours. It's just coming in piecemeal here.
Okay. Oh, I'm sorry. It's coming in a little slow there. Anyway, so yeah, so right now, like I said, jail, if you look at my project on Equity Timescale, we looked at it right there where it said jail is viewed as a timeout. We were providing MAT services, and we were providing long-acting injectables upon request. And so we thought that that would have the most immediate impact. And then within a year of when I started my project to what we're actually doing now is we're in that warm handoff stage with Janus. We started that in December of 2024. And we're currently doing it. We're still working out some kinks, but we are starting to do it. And we're hoping that the data is going to start to show that reduced recidivism and overdoses for those receiving MAT services, long-acting injectables, and a warm handoff, kind of a proof of concept. And then that 2 to 3 year mark, we want to explore, if we are successful with this group, we want to explore other opportunities to expand to a more detailed discharge, kind of access to services for other populations like mental health, unhoused, or other at-risk populations there. Hopefully the sustained success of our SUD treatment, and then that 3 to 5 year mark, we're hoping for success for all populations receiving these detailed discharge plans and with access to the resources. And 5 to 20 years, this is where that culture part comes out, where hopefully not just us, but everybody in the community sees the jail as an opportunity for positive intervention in someone's life rather than just a timeout. So now I think we are at the work backwards part, where it's just real simple, as you guys can say, but pick your goal and then figure out how to work backwards and find, what does this look like? If you have a 5 year goal, what does this look like at year 4? What does this look like at year 3 if we're making accurate success? And what does it look like at year 2? And so trying to work through that the best you can, just choosing your goal, choosing your destination, working backwards, kind of can help you build that roadmap for success. It needs to be interchangeable. so that way everybody understands it in case there is a change of leadership. And then it also just needs to be achievable and hopefully have the most impact as possible.